We are going to talk about a concern that there are too many children and people with mental health issues being locked up in cells rather than getting the social care they need. With me now is Chris Bath. Chris is the Chief Executive of the National Appropriate Adult Network, and now that is a charity which works to protect the rights and welfare of vulnerable people who have been detained or who are being interviewed by police. Outline the problem and the concern that you have, Chris.
Well, there's a number of issues highlighted in a report that's coming out actually this morning from Her Majesty's Inspectorate of Constabulary. One is that there are people who simply are not suspects of an offence at all. They're just having a mental health crisis, but they end up in police cells as a way of dealing with that.
Because there's nowhere for them to go?
Yeah, essentially. Police are always the first responders. They're the ones first on the scene, and there's a lack of accommodation that's suitable provided by health and social care. So the police end up as the default option.
So basically there's a big void between being an inpatient and being allowed to be supervised or supervise yourself in community care.
Yeah.
Right, so how do you fill that?
Well, so I mean, in many parts of the country, there's actually been some great practice over the last couple of years of sending people to alternative, what they call places of safety, which are in a health setting rather than in a police cell. So we just need to do more of the good stuff. But the separate issue that we've got is people who may have some mental vulnerabilities but also are suspected of an offence. And I guess what our area of interest is that those people who are in that category get an appropriate level of support so that they can go through the justice system, but in a way that's fair, and we don't end up with miscarriages of justice.
So Chris, is there a suggestion at the moment that we're in police cells at the moment, there are people that really shouldn't be there? Because I know that a survey by the Royal College of Psychiatrists said 3/4 of psychiatrists diagnosed a young patient as being at high risk of self-harm or attacking other people, but have gone on to be treated in the community. So it sounds like they're a risk, potentially need to be detained, but they're just not being detained in the right way.
Well, yeah, there's a very small proportion of people who, through mental illness, are a risk to themselves as much as to anybody else. And we've just got to make sure that it's appropriate and that the police aren't having to deal with that, because that's not what the police are trained and sort of set up to be doing.
So actually, conversely to what Isabel's saying, she's saying that I suppose the environment is wrong, but for those who should be in that environment, who are a danger, there's also a lack of people who are properly trained to look after them.
Correct. So the training for police is not particularly adequate, and it's not their core role. So what appropriate adults do is essentially look after their rights and their welfare. They also help with communication. So they're going to struggle to understand what police and solicitors are saying, and the police might struggle to understand what they're communicating.
Who's understanding what you're saying? Because here's the big worry, is it not? You know what needs to be done, but if it needs money, surely it is unlikely to be done.
Well, money is an issue, particularly at the moment, but these issues have actually been going on since a long time before, austerity, and they have been solved in some issues, in some areas. And I'd argue actually that when police, health and social care all work together, we actually probably cost less money than when we allow things to snowball out of control, and suddenly we've got very serious situations that could have been dealt with earlier.
Okay. Well, good luck with your mission, Chris Bath. Thank you very much indeed. Good talking to you. We're going to take a break.